Most people have heard of a total hip replacement or a knee replacement, but most people have never heard of an ankle replacement. An ankle replacement is replacing the ankle joint with metal and plastic, just like in a knee replacement, and it's an option for patients with ankle arthritis. Ankle arthritis is a much less common problem than hip or knee arthritis, but for patients affected with ankle arthritis, the ankle replacement can be a very effective treatment option. Ankle arthritis tends to develop from two different sources. There's osteoarthritis, or the normal wear and tear arthritis, or there's post-traumatic arthritis, patients who've had some type of severe sprain, fracture, or injury to the ankle that has led to the arthritis. And by far, post-traumatic arthritis is the most common type of ankle arthritis. The surgical treatment for ankle arthritis includes either replacing the ankle with metal and plastic or fusing the ankle joint using metal plates and screws so the ankle doesn't move up and down anymore to help limit pain. Both can be great options for patients, but if we can keep the ankle moving with an ankle replacement, I think it offers patients a better long-term outcome.